and they might take a step to the left, they might take a step to the right, and it's my job to try to encourage them to take the next step in the right direction for me to be able to do what I need to do. I do see hundreds and hundreds of horses, and I'll walk into stables that are enormous hay feeders with a massive diverse.
Welcome everyone to episode 151 of the Send Nutrition Podcast. You're with your host Bryan today and Angelique. And Angelique and I are going to interview a very special guest today, and it is Jerry Wilshusen, who is an equine dentist with over 10 years experience and is a qualified equine dental technician, part of the Equine Dental Association. And Jerry will join us today to really discuss the missing link, or what really matters more in terms of when you look at the nutrition for your horse and how much teeth or your mouth health of your horse really matters. And I'll just say a quick, how are you, Angelique?
I'm good, thanks, Bryan. Obviously, I didn't do too badly last time. You've allowed me back in the room.
Yeah, we've kept that gold microphone in front of you again, and we've got Jerry here now. How are you?
Very well, thank you. Thanks for having me.
Thanks for coming into Sen HQ today, and let's see this sort of unsung hero of the horse's body in terms of their mouth health and their teeth, and that's what we're going to drill down today for our listeners, to really give everyone that link of how crucial this part of the body is and often overlooked. And I reckon we'll start off with you, Jerry. Your experience in the equine industry, as we know, it's over 10 years now, taking us back to where it all started.
Well, Midge was the first horse I ever rode that Dad had bought me, and she was a absolutely beautiful little brown mare, and she was a hack pony, so I started top and tails. And from there, I grew up on a small cattle farm just outside of Kempsey, west of Kempsey, and those were horses every day. And my grandfather also had a cattle property, so we grew up doing a lot of mustering. But weekends involved lots of pony club, everything involved there with it. So show jumping and all the rest that goes with it. But it was a great experience as a kid. But I gravitated towards something a lot faster. So I ended up really enjoying camp rafting as a younger kid, but then show jumping became part of my life. But by the time I got to 18, I thought that I was going to be off to uni. So I ended up here in Queensland again, and then realised that was a lot more work than I anticipated. And plus the class
Concentration?
Yeah, concentration is difficult. So, but the classroom wasn't a place that I could sort of, didn't thrive, so to speak. But from there, I sort of spent a couple of years and then actually got a job with a really good horseman in the industry at a stable out at Arachula, up to Kevin Thompson. He was a wealth of knowledge for me, and I enjoyed that time that I had with Kev for about 4 years. And his focus of his business at the time was, as I say, racing, but he specialised in starting young horses. And he was a great horseman. So he would start the breaking in process and then took them through pre-training and offered an adjustment spelling facility as well. So he looked after some of the biggest trainers in Australia. And so he had we were pretty fortunate to ride some really nice stock. Yeah, really nice stock. But outside of that, my experiences were sort of, I had friends that had cutting horses, or, friends that had, other sort of, involved in other parts of the industry. So, pretty good experience. From there, I thought that I'd give myself the chance to go and break in. So I got a lease on property at Bedesert, and then started breaking out gallopers and actually had some dressage horses as well early days. But it sort of morphed in towards being more focused on the gallopers. And it was a great business for about 6 or 7 years. And then I come along and had a bit of an interest and pestered, I suppose, the great dentist that looked after a lot of this southeast Queensland area, Gary Peebles. And Gary was, he was a really, really good horseman with the in regards to doing teeth in the way that we operate. And he was, he would just quite early on. He said, "Oh, would you like to come along and do something?" And I was, "Oh no, I just doing the breakers to ride, and I'm on the ride breakers." And about 6-7 years later, I was like, you know what, I think I will. So he said off we trot to Melbourne, hence the reason I spent a couple of years in Melbourne. From there, I came home and try to do my own thing, and it's worked.
And and here you are connected with us because Angelique
Absolutely.
is one of your clients.
Yeah, absolutely. Great client.
Yeah, I've been using Jerry for quite some time now, keeping my boy well with his dental health.
Yeah, and I've seen Angelique's horse since he was a baby, like a baby. So since he was 2 years old, and yeah, it's been good.
And our history, Jerry, we've actually spoken on the phone a couple of times. Yeah. I think you called me, I think you got my number, and we really vibed in terms of the way we want to set up our horses' diets with a hay that is more grassy than those cereal types, and then we were just touching on the information that we're putting out there to the industry. You said just keep going, Bryan and Peter, because it's just what we need, and that's what these podcasts are about, is trying to educate our horse owners to try and choose better in terms of your hay, but then also your whole horse foundation. But it comes down to management, and that includes the whole dental side of it. And today we'll give the good link of how nutrition and the horse's mouth health is really vital. And maybe we just start off, Jerry, as well, your current clientele, I guess, in the horse industry in Queensland. Do you have a vast array of disciplines that you do?
Yes, I do. However, predominantly, it's, I think, just through relationships in prior business or, with people that I've met along the way, it is predominantly flat racing, gallopers, or, the trotting industry, the paces. So, but outside of that, I still look after a lot of horses like Angelique's horse, state performance horses, and, which include, show jumpers or camp drafters or, dressage. So there's a vast amount of horses that I do look after outside of racing.
Yeah, and I understand that you're non-mechanical.
Yeah, that's great. So for us, we use hand tools, and it's been, it's been a great way for me to provide that care to the horse. I feel like I get really nice. I can feel the horse's teeth, through the rasp. It's obviously I don't use sedation. We're not allowed to use sedation. We'll get sit down and not allowed to use sedation. So that's the way that we sort of operate through a level of horsemanship, to achieve the outcome that we want to achieve.
Yeah, and you're no stranger to a horse, so that's...
No, I see one.
But I guess coming from me, I've seen how Jerry does it, and it's very kind. He works with the horse. He doesn't work against the horse at all. It's sort of...
Yeah, we had they're too big. The risks generally are too big. So you have to find that happy medium between... You could probably look at it from a point of view that it's an education process for them as a young horse. I quite enjoy actually doing young horses. And due to the nature of things, come back to me having a background in breaking and, young horse, so do the thrill and see quite a lot of satisfaction in them growing within themselves and having that confidence to, accept what I'm doing. And after a few times, regardless of them being fractures, you just work a little bit differently, or, they really build a lot of confidence. So, yeah, that's how we operate.
Yeah, that's a pretty key point, because horses are flight animals and they can stress pretty quickly if you're not calm, Jerry.
That's right. Yeah, so we try to, the easiest way to understand is you let them move, and that sort of dispels some nervous energy. And outside of that, it's then my job to, and they might take a step to the left, they might take a step to the right, and it's my job to try to encourage them to take the next step in the right direction for me to be able to do what I need to do. That might take a couple of seconds, it might take a couple of minutes. So you're really trying to get a read on that horse the first time you put your hand up. A lot of the time you can really feel the vibe of that horse. Is it a bit concerned about what's happening? Does it know what I'm doing here? No. And then as you progress through the, procedures undertaken from there, it's just, redirecting the horse's energy. Most of the time within, a couple of minutes, they're quite relaxed.
Yeah. And have you had any close calls with a horse?
Yeah, well, riding, I've had many. But I'm still upright and verbally communicating, so that's okay. Now, but within the dental industry, I suppose I haven't, to be really honest, touch wood. And you know what? They actually surprise me every day. Terrible addiction horses, but they actually surprise you every day, because even though they are in a stressful situation and a situation that arises quickly, they are so trusting. So I'll be working. I know obviously that this situation's happening, but if it sneaks up on them, they just trust you so much. Once you've got that level of trust, they might fright, but then they come back to you straight away.
Yeah, I think you've got an advantage having that full horse background as a younger kid and then coming through.
Yeah, it's a good key point, because the beauty of the Equine Dental Association, where I trained in Melbourne, their selection process was great, because it's great to think that straight after year 10 or year 12, or I'm going to go down and be a horse dentist, which is, we want those people. But the years in the field and the years of experience really counts for a lot to be able to give the horse the best experience. So when they're trying to find people, they want to know that that they've had that experience to handle a situation, and also be able to want to further their career in this manner. Follow horsemanship.
Yep.
Yeah, I think having that background in horsemanship would definitely be an advantage. Like you said, you can get their hand on the horse, you get that vibe, you be able to understand where they're coming from.
And sometimes you can, start fighting away straight away, and other times you might walk them around in a circle, or you might just I'm just going to go and rustle around in my bucket for no reason at all. And then all of a sudden you've got a nose in the back of your ear, you're like, okay, we're ready to go. But it's all sort of just, it's not potentially obvious to someone else, but it's the way that I operate to try to see if I can build a relationship really quickly, because you don't have a lot of time, but you have enough time, Yeah. So that's how, they're a beautiful creature like that.
Yeah, they're absolutely fascinating. And this is another part of it that will give our listeners a little insight to how often you would normally get your equine dentist out.
Sure, yeah.
And if you want to talk about, I guess, the way the teeth grow.
Yeah. Horses are cool. So in the fashion that they have 12 molars, top and bottom, or premolars and molars, and then they have the 12 incisors. In addition to that, the geldings will have canine teeth. Some mares will have canine teeth.
What's the reason there?
So for the mares,
Yeah.
I don't know, maybe they've got a bit of testosterone floating around. I'm not sure, but
I'll do a quick Google here. Yeah.
they'll run it. No, they run the paddock generally.
Yeah.
Yeah, they're the boss of the paddock.
Yeah.
But I think that's generally what the case will be. And then in relation to eruption, so whilst the horse is young, so from the time they're sort of, in their early years of losing their deciduous teeth, so deciduous teeth are generally referred to as caps within the industry. People know what caps are. Well, they're, for us, they're deciduous teeth. And then as those deciduous teeth come off the erupting incisor or premolar, because they actually lose from the time they're 2 to the time they're 4, a little bit later, they'll lose 24 of those baby teeth. And so in the case of a high performance horse, namely in the racing industry, for instance, and even some of the younger horses, some of the futurity horses through cutting or, that sort of stuff, their expectations are really high. And through coming with that expectation, you got deciduous teeth or caps coming off left, right, and centre, and you're trying to manage the situation for their best performance and for their ability to eat. So, because once that cap's gone, it's less a surface. So you really want that eruption process to take place. So that eruption process happens really fast whilst they're young, and as they age, it pees right out. So coming 20 plus,
Yep.
the rate of eruption is quite minimal.
Okay.
It's really quite minimal. So, but whilst they're young, the serviceability for the horse whilst they're young needs to be, rule of thumb would be, most people know 12 months to look after a horse. Well, in relation to a younger horse that's in an environment that's got high expectation in performance environment, which will mean that they're on heavy feed, and with that heavy feed comes faster eruption because the surfaces of the teeth are wearing. You might see a young racehorse 4 times a year. So you might see a dressage or a show jump or a kept up horse of the same age, 6 months, due to that eruption process. So, they're a really interesting process how they erupt, and it can impact the way they eat heavily.
Do you find that when they are erupting like that, that the horse may go off its feed at that time, or will they drop weight because that they're uncomfortable?
Yeah, absolutely. I was just great, Chris, because they definitely do. The feed stuff can get caught under that premolar cap, and they'll you may notice if anyone ever had a horse that's of that age between 2 and 4.5 sort of thing, you might see the old rolling the tongue sideways, or all of a sudden horses are riding around sweet, and then you're like, what are you doing? Like, you just two heads tilted, hitch drop, there's no connection, complete disengagement. There are many obviously other various factors, but from going from that to that, and then you walk into the box and they got a wet feed, or the bucket's full of feed stuff, or the hay is sloppy and they're rolling their tongue around. It's a really good observation to go, hey, let's get a gag with you and find out what's happening. It may not be a cat, but it could, because that eruption process is so quick at that stage. It may mean that maybe his tongue's sort of slipped in the wrong position and give his tongue a bit of a nick, or caught the cheek or something like that. So, which happens.
Yeah, and that whole structure in there has to be working well, because they don't actually chew it is a grinding action.
Yeah, very right, Ron. The ability for them to eat all the time, obviously, is important for nurturers. But, from a point of view, when they're losing those caps, my job in that position is to help and aid that process where they can eat better. So I go regularly to take the caps off if they're, digitally loose. So if they're loose, we'll pop them off. And that instantly will give that horse relief. And that opposing edge that was causing that potential cut and discomfort to the chewing process. Because if you can imagine that the adult tooth will push the baby tooth off, the deciduous tooth off. So it's like, just out you go. But during that process, it then makes the table of the teeth uneven comparative to the opposing. So they're chewing like the crocodile, or, they're not using, as you mentioned before, Brian, they're not using that grinding process correctly. So once you remove that problematic cat, they're away.
It's better. And there's a huge feedback down the line, because the mouth or the teeth is the start of the digestive tract. Why do they have to grind their feed or their fiber source down? Is because if there's a larger surface area going through that whole digestive tract into fermentation, you can actually not unlock a lot of the energy that's inside the food. So if that grinding process is not correct, the small intestine might not get enough out of that food particle, which is larger, and then when it goes into the fermentation part, that's actually not where it's meant to be digested. The part was meant to be broken up by enzymes in the small intestine. So it's such a crucial part that is actually really connected to nutrition, as Jerry has described, and it also has a microbiome as well that we know that needs to be kept, I guess, not too sterile, but has a good environment that's not high in sugar and starch.
The oral cavity itself has its own flora and fauna, and it's imperative for that to be healthy, obviously. And with that, and in sort of backtracking to what you were saying before regarding enzymes, I have enzymes within the oral cavity that starts that, digestion process.
Yep.
Right there. So, which then sort of says to me, okay, so long stem fibre has to be there because it has of multifaceted importance to the horse. From even that chewing process makes the horse calm and relaxed, and can then make the horse extend that feeding period within the stable environment. So, and I understand that in certain disciplines that might be tricky, considering, too much, condition on the horse or something like that, but that can be alleviated through any forms, through the way you let the horse access that feed, through hay nets or double hay nets, or a porter grazer or something of that sort of ilk. And then from there, you can extend that chewing process, which means that the digestion process just keeps looping back onto itself all the time, as much as you possibly can. It starts at the mouth,
Yeah, and that saliva production is so important, as we know. What's your opinion on chaff?
It's good that everyone's got a job, but it can be. Well, I've used chaff, so I can't say it's bad. But the more that I've educated myself and the more that I've understood about teeth, I think the most important thing is that the horse has long stem fibre.
Yeah.
Because its importance is viewed. Its importance is huge. It's a funny situation, chaff, because it actually does have its place, but it has its place probably more in a medicinal setting, maybe like to carry some supplements, but carry some whilst may be difficult to medicate for whatever reason. So it does have its place, in my opinion, for the overall health of the horse, and most definitely for oral health, is to have a long stem fibre.
Yeah.
Of some sort. And I have known, horsemen, good horsemen, and, they would still feed a chaff format, but they'd cut it at 4 or 6 inches, which, so they're still actually replicating as best they possibly can. They just changed it for the setting they're in.
Yep.
So, you do your best. But for me, long stem fibre is the way to go.
Yeah, we're on the same mantra at Sen, because a lot of the diet consults we perform, it's about cutting down that chaff volume and increasing that long stem roughage, because scientifically speaking, the chewing action of a horse on chaff, there's half the amount of saliva produced compared to a long stem roughage. So you're getting a lot more saliva, and this saliva is not there just for the sake of it, because the stomach acid in the horse is actually around 30 to 40 litres a day. The stomach is producing, and what helps buffer that is the 20 to 30 litres of saliva that a horse generates from that chewing action to help buffer that gastric environment. And as we know, it's susceptible for ulcers, and so this is nature's natural ulcer preventative by just providing that long stem roughage to promote that chewing action. And we totally agree with Jerry in terms of using it as a carrier, but you don't have to feed 8-9 litres of this carrier called chaff. Bring it down to half a kg, even less, 200 grams, if you must, or if you must use it to give a better texture to your hard feed. That's where we come in with the chaff.
And put that money that you're saving on chaff into long stem roughage.
100%. That's exactly what we want to see.
Yeah.
And the rule of thumb with the long stem roughage is you get your horse's weight, to say it's a 500 kg horse, minimum 1.5% of this in kgs. So that would be around 7.5 kgs of a long stem roughage per day minimum. You look for your quality, your grassy hays. A good quality one is not going to give a hay belly. Like back in the day when they thought giving hay before a performance would give obviously that bloat or hay belly, it is actually producing saliva to help buffer that gastric environment to lower the risk of ulcers. But then also Jerry touched on, it is actually helping their temperament and keeping them calm and keeping them in that natural grazing action that they want to be as a horse.
So in regards to hay nets, Jerry, because is that little bit of controversy that hay nets damage horses' teeth. So, we want to slow them. If a horse is in a situation where he doesn't have access to fresh pasture and hay is his only source of long stem roughage, are there any particular hay nets that you're going to recommend in regards to dental health? Like we've got the knotless ones now. Is there a lot of benefit in putting that extra money into something that is like a softer net that has no knots?
Just cut back a little bit. Just want to mention that for me, what is key is try to do everything we possibly can to feed the horse on the ground. I know that's a little bit unrelated with Sarah, and that is just so important for their head to train. And whilst they're eating, their jaw actually, whilst they're eating, it actually partially subluxes. So, and that bottom jaw will slightly sublux, which then gives that opportunity for the feet to grind really well in that downward position, in the head in that downward position. On the ground is ideal, obviously. But some environments that can be a little bit dangerous, so you need to, elevate that feed. But we want to keep it as close to the ground as possible. In relation to hay nets and finding a slow feeding method with the long stem roughage, I'm not sure that I've seen a huge amount of horses that have, adverse reactions to hay nets. But what I'd say is if the fibre of the hay net could be softer, and I think you said it before on regarding the knots, because as they tear over time, if that was a permanent solution, that will wear. Yeah, that will wear. Well, I've seen feeders a buck that like a giant round tub, and they have the hay put in them, and they have an insert. I think they're probably the best solution.
They're porter.
I think they're called a porter grazer. Yeah, they're a really good solution because they're multifunctional. So you can use that as a feed bin and as a hay bag, well, as a source of the way to slow feed your horse, and it works with most hay. I've used them myself, and they work with most hay tops, and so you might have to tease the hay a little, but horses, they're unbelievable with their mouth. Like they'll find one tiny strand of hay, and then off they go. They'll get a run, but they're great. You can put half a bale of hay in one of those. They're as robust as insanely robust. I've seen colts. I remember the first time I actually seen it was in Melbourne when I first started. Started my debut career, and there was a colt, 2-year-old colt, in that stable, and he was basically giving it the death treatment, and they're indestructible, and you just place your grain or whatever your hard feed source is on top of that, and they can be happy for hours and hours and hours, eating half a bale of hay, and then the horses that are a bit lighter actually tend to put on the weight because it's a slow, they're slowly eating regularly rather than seeing a bulk. And then the larger frame ones, the more rotund ones, are then actually being restricted, but not completely reduced of their source of long stem roughage, which is also important. Yeah. So those sort of things are my biggest push, that style. But there's no issue with a hay net. Hay bags are great, but they tend to sort of still get drilled pretty quickly. But it's something. Yeah. Something.
That hay net, like sort of dangling down near to the ground, is probably the best position for them. Yeah, because I've talked to a lot of body workers saying that they engage that postural stabilizer muscle from their pole to tail, so it actually helps that correct top line development, that healthy back and neck. It's so underrated because if they're doing hours and hours of grazing every day, and you're having trouble putting top line on your horse, it could be that simple management for your horse that could be stopping it.
And in addition to that, in relation to what your bodywork is saying, they're absolutely right, because you can actually get, if a horse is fed up from a yearling, it's off the mud, it's coming into the stable, it's having a sale pref. If if it's fed up high, at chest height for everything, for the majority of its younger years, they can actually form a malocclusion. The malocclusion is uneven wear, so the first upper top tooth might end up looking a little bit like a parrot's beak, and then the opposing tooth to that is sitting behind that. So, and that occurs due to the fact that their head is not down. So from that top to tail, the tooth bud, the processes of the teeth aren't actually engaging properly, so they're not falling down into that position as that horse subluxes its as the mouth to chew. Yeah, they're not evenly wearing the teeth away. Yeah, so I'm one of those sad people that keep saying, feed on ground, just feed on ground.
They get hay pillows too, I think. They're like a net that's designed to be on the ground or a fellowship. Yeah, and Onge also mimics that natural, moving around and foraging, and they tend to kick the net around, the hay pillow around the paddock, and
any of those solutions. But no, I think that the hay net, hay bag, porter grazer style of feeding, where you can just try and extend that time, is key.
Yeah, it definitely touches on things to think about in terms of their respiratory health, including and their teeth or mouth health, in that sense, the way they graze. And if you look at how they are in the wild, they do pick off trees, but they're not doing that as a grazing source. So they're not acting like a giraffe would.
Eating bark. True. Or something to that effect, or that, horses will eat obscure things. But, why. There's a lot of time there's a reason behind why, I think, that they'll eat the bark off a tree. So I remember growing up, there's a lot of poplar plantations where we grew up, which was fun for matchsticks, and they just have to grow well in that area. And our horses would just eat poplar bark sometimes, and what's the deal? So maybe there was a factor that there was something lacking in their diet that they weren't getting, so they found it themselves. Yeah.
So on that note of horses will eat unusual things, what's the most unusual
Thing you've got? I did have fingers and thumbs, so that's not one. I'm right there, but yeah, they do. I don't know, maybe a baby thing, but I had actually been called to a young horse that had a tyre feeder, and look, some tyre feeders are great so long as they don't have the wire in them. But that tyre feeder, that young horse thought it would get creative with the tyre feeder, chewed it up, and had managed to have some of the wire caught between its second and third premolar. Now, I think that the reason it was doing that was because it was a young horse, and what it was trying to do was chew on something to alleviate the cat pressure, so that deciduous tooth pressure. So if your horse is eating a stick at 3, it's okay. Like, yeah, it might be trying to alleviate some pressure in its mouth. So there was the outcome was great, but the presentation was pretty wild. It was drool, and it had quite a lot of gum tissue damage because of damage around the site of where the wire was sitting. So, but fortunately, that's where it stopped. Yeah, so we got the wire out, took the cap out at the same time, and a couple of days later, 10 minutes later, he was eating again. So
explains all the complaints of people with young horses. They eat the rug off the fence and all the rest of it. They're probably just trying to relieve some pressure in their mouth.
Yeah, maybe. And a lot of I see quite a few racing stables, and they'll put some bollards or stuff in the stables, which is sort of a great idea for not only boredom, but they'll chew on that bollard a bit, the young horses, and you'll see a fresh bollard go into a 2-year-old or 3-year-old stable and comes out looking like it's been through the charfer. Okay, well, that works. Well, must be time for me to see him.
What would be the most common issue you see when you visit people, especially someone that hasn't been regular with their dental checks?
The first and foremost obvious issue is ulceration of the cheek tissue, and that's a natural occurrence. That is a natural occurrence. The good fortune that we've had, being able to be humans looking after the horses, we've been able to alleviate that for a long, thousands of years. People have been doing loss teeth for thousands of years. And that is the number one issue that you'll see. Over the last, from me talking to my mentors as well, that over the last 20 years, it's become really good. People are looking after horses really well, in relation to dental. However, that if that isn't the case, the on-flow effect from that, obviously, from a digestion point alone, the feed's not being chopped up correctly. So that from a cost perspective, they're not getting anything out, not getting value out of the feed, and they're also increasing the incidence potentially of colic because that feed's not being masticated. And then from there, right at the core of it, where they're eating, the sharp enamel points that occur, they turn into like flares, like enamel flares. And as the horse eats small amounts of those, small amounts of feed stuff gets stuck up on top and around those flares, which sink down towards the gum tissue that connects to the tooth. And then you might get instance of, a little bit of slight periodontal disease or something like that. As soon as you alleviate those sharp enamel points, no more ulcerated gum tissue, and you reduce the incidence of that feed sitting down there causing a bit of periodontal disease.
And you'd see it in behaviour as well, yeah?
Oh, so true. Yeah, true to mention. There's really big behaviour, and some horses. There's actually, you may be riding a younger horse or an older horse for that matter, and your training regime's just not going quite so well. A lot of horses will actually get really far behind the bridle, because they're trying to evade that sharpness, and they'll become insanely light when it doesn't feel like there needs to be this light, this horse. And other horses might jib, like they'll throw their mouth into the bridle, and throw the mouth into the bridle. Or, as I mentioned earlier, may sort of become a bit disjointed in their shape. So by addressing those sort of things, those core issues of ulceration and and like if the teeth aren't meeting correctly, we're helping heaps. We're helping heaps from a performance standpoint and a heating standpoint.
Yeah, I reckon it's so underrated, the mouth or teeth health of your horse, because we get some diet consults that come in, and we talk in general about their horse and any symptoms they're showing, and they might say there's a bit of head tossing, like grinding teeth under saddle, or they label their horse a bit naughty. But when you look at how much discomfort can come about, like poor health in the mouth environment, it's a no wonder, like they're quick to say, oh, I think I got ulcers or something like that, and they're not looking at the front part of the horse.
Yeah.
Straight to that hind
Ulcers seems to be the buzzword in everything if your horse is naughty, and then working back, haven't had the dentist out for 12 months, 18 months.
Yeah, that's right. Because especially if it's been a long interval between care. So, but yeah, that is true. Depending on what environment, there can be other factors, but in relation to teeth, that's it highly sort of in relation to teeth, it can make the difference between the horse consuming the best for its getting the best value out of its nutrition and performing the best. And I really believe that temperament issue, not issue, but that temperament topic that we touched on earlier regarding feeding long stem fibre can vastly make a difference. And I do see hundreds and hundreds of horses, and I'll walk into stables that are enormous hay feeders with a massive diverse offering. The fact that they have enough to carry them through between their hard feed time means that they've always got something to do, so they can choose something, and it's a form of them feeling, as close to their natural environment and relaxed. And then you might walk into another stable that might only offer it with their hard feed in the morning and offer it in their hard feed in the afternoon and a small quantity. They're a pretty busy sort of a stable, and the horses will be sort of maybe feeling a little bit upset, or they're moving around a lot. But yeah, like I said, the stables that have got plenty of offering, they're quite a stable.
Yeah, I could probably add to that anecdotal evidence in terms of when we have consulted a trainer that has not fed a lot of volume of roughage, and then they switch to a higher volume of grassy hay, we'll often get the call, they're absolutely bolting for this hay and overdoing it. And we said, give it 2-3 days. They know you're not going to take it away because they think you're going to take it away from them, and they'll settle down. And every time they call back and said, yep, they've all settled into a nice rhythm of volume of hay ingestion. And it really does make sense. So if you look at the way the horse has evolved, obviously a trickle feeder, the hindgut of the horse is used for fermentation of fiber, which is the main energy source. So feeding this, having that gut-brain connection, so serotonin, which is what that feel-good hormone is, it's produced mainly in the gut of the horse. If they're producing good amounts of this because they're trickle feeding, they're grazing nicely, it's no wonder you're going to see that through with their temperament.
Yeah, that's an awesome point, Bryan. That just sort of clarifies what I'm seeing in the stables, and the importance of access.
Yep.
And sometimes it can be tricky to source what you would love, but at least they've got access.
Yep.
To deny it at all is detrimental for not only, as we spoke about before, temperament, but that hindgut being fed continually, and being able to access that long stem.
Yeah, and it goes even further to that in terms of lowering that colic risk as well, because they need that movement of digestible fiber and indigestible fiber, such your hay quality, to come through the other end into the manure, because you don't want this part of the horse to be sort of undernourished, because you can run into all those issues and that dreaded C word. Mm. But I also see a lot of pushback with I won't generalize, but some trainers will say they'll get a hay belly if they're ingesting that much hay. And that's incorrect because it's the hay quality. And if you have a good quality hay, it will not produce that indigestible fiber, which is then showing that hay belly symptom. It's now proven. So I think that's one of the pushbacks that we've had in the past. But once proven with a quality grassy hay, we profiled a lot of parts of Australia with hay and pasture tests and read them weekly to really get a good understanding of what you're working with in an environment and where you need to plug the gaps in with your hard feed, because that's the only complementary part of this. Their main source of calories should come from their roughage or their pasture or hay source. But then, as we've touched on today, you're spending all this money on feed or hard feed and supplements. If you don't have the dental health right, you're actually wasting money because they're not getting the potential amount of nutrients out of that source that you're giving them if their teeth are not correct.
Yeah, and to add to that sort of situation around, hay belly, I wonder whether there may be sort of some link to a dental issue there as well. Maybe they're not, this is prime quality feed, and we're still getting hay bellies. Well, where's your dental program at? Is everything up to speed, or are they just sort of doing their best to shovel it in? So if they're masticating that properly, then, it's flowing through the system evenly.
Oh yeah, definitely. There is definite link there, because if you look at undigestible fiber and it's not ground down, they're not getting that surface area for those microbes to really digest, and there's undigested that can cause that hay belly.
And the POOV, this causes a disease, but we all see it and pick it up every day, is your best observational tool if horse is in poor condition or there's something else going on. Squash one of those poos and see if there's some longer strands than chaff to that size, and that will mean that the mastication process is not happening.
Yeah, 100%.
They're highlights that the horse can, if it's in good condition, can actually make its own chaff. So it doesn't need to be. It's a great way to use a tool of assessing whether that gut is getting nutrition by looking at their poo, and you can often see in their droppings if something's in poor condition. I've gone straight to the droppings, forgot the horse, and just gone straight to the droppings, and I've noticed that there'll be some big curly strands in there, and I can nearly guarantee that it's more than ulceration, because the horse is pretty tough and they get used to that pain, unfortunately, or that discomfort, so they'll just push through. But when I see some curly ones, there might be a really loose tooth, and it might be a mid to old age horse, or there'll be an issue where there's one really dominant tooth and there's one not so much dominant tooth, which means if they can't chew across their arcade, they can't chew across the table of that tooth to masticate properly. So then come in and, offer the solution by making a reduction to that tooth or removing that tooth, or
So to go back to like horses in nature and how they're evolved and how they should eat, if you are feeding a diet that is high in sugars, say you're feeding a pellet that has molasses in the pellet, are horses like humans? Do they get cavities? We eat too many lollies and we get cavities. Do they?
In relation to the pellet exactly, I haven't had sort of a huge amount of evidence to support that myself. But what I have noticed is that in relation to some cereals, in relation to cereal haze, there has been a definite link, and for me, I have one stable in mind definitely that has had periodontal issues and periodontal disease in their stable in horses of all ages. And the best case scenario with that, the best case observation with that, is that farm actually trained with this particular feed regime, and so did the pre-training yard, and so did the spelling yard. So it was really easy for me to go, I think it might be something going on here. But to be sure, I then went and I looked after all of those three parts of that business, which was great. And then I was getting a lot of hey, Jerry, can you just check this, mate? Can you just check this? This is just not right. This horse is slobbering and not eating. And what was happening was they were eating about 6 kilos of grain a day, which were the, and then they were offering ad lib cereal grain, and that cereal hay, pardon me, that cereal hay was just blowing the calcium phosphorus ratio out of the water. So they were, I don't know what they were, but they should be 2-1 from my understanding, and they must have been 3.5 or something. It was just insane, and they. And another marker, I walk into the stable and the smell was just crazy. So it was like one way to feel like, so the hindgut was not happy. It was not happy. And you'd walk around the stable trying to dodge these pretty awful landmines.
Because, correct me if I'm wrong, is it that time of chewing a high sugar, high starch diet? Like, do you think that's affecting, obviously... So sugar doesn't directly rot teeth, from my understanding. It's the bacteria that eat away or drops the pH in the mouth, and then that eats away at the enamel.
Yeah, so it can be. So what I was noticing was horses can actually get like a benign sort of a cavity called a caries, but sometimes they can escalate. What I was actually noticing was at the gum cuff where the tooth actually connects to the gum tissue, between the teeth, they were forming, like a gap, or what's termed as a diastema, but a gap. And I think there's some correlation between leaching, for bone density, which was allowing that process to occur. So I'd have horses that would have, gaps that would be the size of your pinky, just full of this cereal hay. And there was absolutely nothing that I could offer outside of suggesting that maybe there's a way to rejig your nutrient profile to build that calcium level back up. Oh, we're feeding calcium. Okay, that's cool, but it's not coming in the volume that is required via long stem roughage. So, that's where the biggest, from an oral health sugar perspective, that was the most damaging that I'd seen to an entire stable. But the beauty of it was they were great people to work for. They just obviously gone down a path of feeding directly, maybe off paper, and the energy requirements. And I must say these horses were really big, like as in their body score was really, really big. They looked good, but they weren't healthy. I didn't think they were healthy. They were too heavy and they were carrying too much. And once they changed their nutrient profile, over time, all of those periodontal issues cleaned up.
Yeah, wow.
It can be helped, and I'm sure with a better diverse diet, you can alleviate a lot of those problems. You can see those problems in a minimal fashion, even when you see it in the diet fed overall, so if it's fed at 50%, you can start to see these little changes in their jaw.
Yeah, wow. And when you look at that example, you got 85% of the diet makeup being your forage, and if you're getting that wrong, that 15%, the hard feed and the supplements, is not counteracting the mouth health or the teeth health enough. And that's what I think Jerry has explained, because when you look at cereal hays, they include oaten hay, wheaten hay, barley hay. They're the ones we try and shy away from. We were looking more for the native grasses like the Rhodes grass. Grassy lucerne is fine because you've got the calcium source there as well. Just don't have the majority of your roughage being just straight lucerne, because your protein will go through the roof.
The issue with that oaten situation is it turned out to be a great outcome for the horses. They changed the way they were feeding, which was great. But what had other concerns for me outside of my role was that what if it was doing that to the mandible, like if it was doing that to the jaw, what else was suffering? So from a performance perspective alone, I could tell that the gut wasn't happy. But outside of that, what's it doing to the bone density if it's already impacted the mouth? So
Pretty scary.
poor little horses, they're suffering a fair bit.
Were they on omeprazole as well?
I'm not sure.
because that's got a issue with its calcium absorption for if you use that for longer than the prescribed time as well. So then you're even behind the 8 ball again.
These horses were also pretty girthy, and a lot of those situations are married into those necessities for using potential medications, like you mentioned. The solution to it was changing the diet, and the horses turned out to be healthier again. But yeah, it was really interesting, and it was a extended observation that I had, which was great. But yet it makes a huge impact when it's fed at that volume. It makes a huge impact.
Yeah.
I was going to ask the question, like in regards to hard feed. So obviously we have our Sen Grain-Free Ultimate, which is a fibre-based feed, which is designed to balance out where the gaps are in our Australian soil, so in our hay and pasture. So we promote to have a small hard feed, and the main part of the diet as the roughage in the form of long-stem roughage like Rhodes grass. When somebody's feeding a hard feed and going back to like those young horses potentially having the sore mouth, not being able to chew properly, our pellet can be soaked into a mash, or it can be fed as a pellet itself. Would you recommend somebody feeding that soaked for the dental health? Is there a lot of benefit feeding it soaked, or is it okay to feed it either way when it's not in huge quantities?
Yeah, I think having the opportunity to have a softer feed is great. Given that the dental hygiene or the dental care is kept up to speed, I feel pretty confident that a horse can eat grain, but having the option to be able to have a softer feed is great. There are going to be stages within a horse's career, potentially going to need some form of grain to increase that energy level. And my role is to make sure that the dental care is up to speed so they can masticate that properly. But what I'm probably not a big proponent of is making it too wet. Yeah, because then they're just slurping and that chewing actions become sort of reduced. It's a really sad topic when all I talk about is chewing.
It doesn't make me hungry, so. But I guess it's only for those older horses that have lost their teeth that they have no choice but to slurp.
That's right.
Yeah.
Yeah. So those feeds, as you mentioned before, that is beneficial for those oldies. But you would be I'm daily highly surprised. I see some old guys, and I'm like, how are you doing that? You've got 4.5 teeth left. How are you managing that? And they're still managing to chop away on some Rhodes grass, or chop away a bit of grassy lucerne, and so they surprise you. But I think those horses also know how to look after themselves, so because others I'm like, please, just maybe this is the time where we cross into the wild side and feed chaff. Well, maybe can you just consider that, because I don't want to come back for a choke. And I come back every year and this horse is still just sucking away on the Rhodes grass and having a wow of a time. So it's great that they can do that. I'll put my hand in and I'll pull out what resembles chaff, so the horse is still doing something for itself, so if they can justify that.
And so to summarize that for our listeners, if you can choose the grassy hays over the cereal hays, I think it's going to be beneficial for your horse's mouth, and so for your horse's dental health in that sense. I came across a saying, and I just wanted to get your view on it, Jerry. So if someone says, that mare's getting a bit long in the tooth, does that mean it's just getting older because teeth get... I don't know how to explain it further.
Well, like everything with horses, there's 400,000 interpretations of one thing. But age does relate to long in the tooth, and they will... if you were to look at the front of a 20-year-old horse's, like, open their lips up, and you look directly from side on, the angulation of those incisors is going to be vastly different to something that's 5. And that is natural due to the eruption process. So they wear the surfaces of those teeth, and the root processes of those incisors will just keep erupting. But you can see horses that have potentially been wing suckers and they're 25-year-old and they've got these little nubs. Well, it's tricky for them. They can't really particularly eat pasture well, but they can eat hay perfectly fine because their molars are great. So just because the incisors look a little bit ordinary doesn't mean they can't masticate inside. So to look at them in the front of their teeth and go and write them off as they've got no teeth anymore, well, their molars are probably in brilliant condition, and I've got plenty of horses that are like that on the book.
So can you tell the age of a horse by their teeth?
Oh, yeah, you can.
Yep.
Yeah, you can be. You get, especially race horses, younger horses. I see race horses every day. So you can age them within 3 and 6 months of looking at them, And the beauty of that is that because their deciduous teeth erupt at a certain period, you can go, okay, well, that's 2.5, well, that's 3, and that's 3.5, and that's 4. As they get older, they can be a little bit more difficult because you can pending history. So, if they've grown up in a drought, the teeth are, their natural, ability to stay alive is to stay alive. And the teeth sort of get shelved. So they might have ordinary sort of teeth if they've come through a drought or grown up through a drought. However, when and the older they are, the more difficult it becomes to age them. Yeah. Certain things will happen in the mouth. They have a star in the incisors that changes shape, and then they have a loss of enamel on their actual premolars and their molars as they age at certain periods. So, yeah, you can age them. Yeah.
Do they keep growing?
Absolutely.
Yeah, they'll keep growing forever, but by the time they get into their 20s, it reduces drastically. So the importance of being really minimal in your care, in the fashion that when it comes to filing, we want to be really careful to look after that horse because we don't have the option for that eruption process to take place again, to recorrect anything. So being really minimal and filing is just what's necessary off those enamel points. And at 20, what they've got is what they've got. We just need to look after it.
I wonder if people actually do fully up. Like I've spoken to people before where they don't actually realise that horses' teeth do continually grow, and that's why having that regular dental is so important.
That's a great point, Andre, because that can be a situation that you come across with people. And it's only an education thing, do you know what I mean? But yeah, they do. And as I mentioned before, the younger they are, the faster they grow, the quicker the ulceration occurs. And the other mouth-related issues, if they're under 4 years old, recaps and deciduous molars and incisors. So, it is important to keep that routine dental care up. You're getting the most out of your expensive horse feed that we have to buy. You're getting the most out of the value of your opportunity to have a good ride on your horse. Most of all, the horse can eat correctly, and so it's going to be comfortable. Temperament's going to be good, going to alleviate any silly little behaviours that potentially turn up.
So apart from having regular dentals, have you got one tip that a horse owner can do in between visits that's going to help keep that oral hygiene at its best?
We're just always considering the mouth as its own sort of happy little microbiome, its own little environment. So, excessive use of anything that's chemically enhanced or anything like that can reduce that. I don't think that many people do, to be fair. But outside of routine dental care, they really should just look after themselves.
Yeah, so we don't have to get the toothbrush out regularly and brush the teeth. And
you can go for it.
But I think overall, having a balanced diet with the correct calcium-phosphorus ratios and lower in sugar and starch will really help support their bone structure. But then that extension of that is their teeth, as Jerry's outlined on this podcast. Because it's been fascinating, the conversation today, Jerry. Thank you.
Thank you for having me.
Thanks for
again, now this is another one of my this is my dentist, and you've had my body worker.
Yeah, are we getting every part of your horse family to come in? When does it all come in?
I'm working on it, Jerry.
I'm gonna make Skeet talk first. No, it's been fantastic, and it was just a coincidence that I have spoke to Jerry before on the phone, and we're aligned in our theories in terms of feeding horses as they should be, or as nature intended, and trying to get close to that in the domestic setting. We know everyone has different environmental factors, and there's genetics that play a part. Actually, going back on to, I did fact check here, in terms of, wait, I've got it here. So it all just does come down to that genetic variation that is a smaller percentage will have slightly higher exposure to testosterone during their fetal development and may trigger that growth that we're seeing. So yeah, that's very interesting.
Yeah, that the canines, it's a funny situation. I enjoy actually seeing a mare with that because most of the time they're actually really good to look after. Yeah, they're really good to look after. Not sure. I think they're generally a boss of the paddock.
Yep.
So they have a air of dominance already. So we can sort of do the dance and then both accept where we're at and then it's done. But they are, if you've got 2 or 3 mares in a paddock of 10 mares or something, like I'm referring to brood mares here, your breeding setting, well, it could be an unruly paddock until one of those mares or 2 of those mares are taken out, and then sometimes that's not always the case. Sometimes they run the paddock, sometimes they don't. But you did say it; they will run the paddock.
Yeah, wow.
Yeah.
So, if there's any final words, Jerry, that you'd like to say?
Oh, I'm hugely appreciative of letting me talk about chewing hay, sad as it is, and the way they've got to, and how I can be a part of that process for the best health outcome for the horse. So, and best health outcome for the horse and the owner, for that matter. But no, I just appreciate you having me in.
No, that's a good. We're happy to amplify the message, and it just helps our horse owners understand a bit more about their horse and who wins in this. It's the horse at the end of the day. So
yeah, no, they're a beautiful creature, and I'm lucky that I get to hang out with them on a daily basis. And thanks again for having me.
Onge, any final word?
Oh, I'd like to thank Jerry for coming in and taking time out because I know he is busy. I can highly recommend him as long as I've still got my slot. I'm happy to highly recommend him.
I don't get away now.
No, that's all good. No, thank you very much, Jerry. And for our listeners, if you are confused about feeding your horse, we do offer that free diet consult at our website. The booking, you'll either get myself, Peter, or Angelique. Help really simplify the way you feed your horse by getting back to those nature knows best principles. So yeah, we thank you guys for listening. This has been a chock-a-block one. This is going for a while. So thanks, Jerry, and thanks, Onge.
Much love. Thank you.